I stand in front of you not representing Texas Tech, but representing the entire medical community that you see behind you. This wouldn't have happened without Beto O'Rourke first identifying the problem, quantifying it, and making sure that it was an important issue, not only here in the community because you knew it was, but making sure it was important in Washington. And then assembling the entire medical community. And there is no exaggeration. We sat together in a room together. There wasn't a leader, except I said David Bookmiller was actually the leader. But to say, what are the needs of the community, the veteran community here, and how can we meet them collectively? It's not just about a single university or a single hospital or a single health entity, but what are the needs and what do we need to do to meet those needs? And the plan that Congressman O'Rourke rolled out to you was a plan that was developed by the committee, honed by the committee, and presented before Secretary McDonald in Washington. I had the privilege of doing that on behalf of the committee, but not for Texas Tech, for the entire community. And we are entirely behind this plan. And at the end, we could see that we're presenting this plan. It's countercultural. It's very different. And by the way, it wouldn't happen without Gail Graham's leadership saying, I know this is out of the ordinary, but we think it will work and we think it's necessary. And my commitment or my challenge to the Secretary was that you give me a cohort of veterans and let us do what I'm going to call the El Paso plan. Not the Texas Tech plan, the El Paso plan. And at the end of a couple of years, you see whether it's less expensive, you see whether their wait time is decreased, you see whether their health care is increased or not. Just give me some time and let us show you what we can do as an El Paso community. And I think what you're going to see is what was proposed isn't going to be unique to our community. I think it's going to be rolled out across the United States. What can we bring to the table? Well, obviously, our collaboration with Gail allowed us to bring new residents to the VA. And by the way, we know that if you train here, you're more likely to stay here and practice. That is, you get a vision for the mission. You understand what it's like to work with veterans. And if you've not had the opportunity like myself, my dad was a veteran of 22 years of the U.S. Air Force. If you've not had the opportunity, you understand how important it is and what a rich resource they are, and you want to care for them. And so training those individuals allows them to stay here. By having a medical center where we recruit faculty, we can do joint recruitments. And that's very common across the United States. It was common in Dallas when I was there working at the VA. It's common in Maryland when I was there, and it was certainly common in San Antonio as well. So those resources we both bring to the table. The ability to have a health information exchange across the entire community, absolutely essential. And the opportunity for the entire community to meet the non-core competency needs of the entire community, the veteran community, is essential as well. So I'm pleased that we're able to participate. We're only one of the participants. You see everybody standing behind me.